Good afternoon, everyone, and thank you all for joining us for the Power in the Public Narrative webinar series, where we're focusing on advancing health equity and the folks who are doing that across Chicagoland. We're really excited to have the folks at Equal Hope sharing with us about the work that they do in helping to reduce disparities in women's health. Joining us this afternoon is Dr. Paris Thomas, Sarah Lohman, and Donna Lynn Schaefer. And I'm going to hand it over to the team at Equal Hope.
Thank you guys so much for having us. As you said, we're Equal Hope. I'm Paris Thomas and the Executive Director of Equal Hope. We also have Sarah Lomahan, who's our epidemiologist, and Donna Lynn Schaefer, who is our community health worker. 1 second. Okay. Y'all can see my screen. So to start off, where everything began, Equal Hope's origins begin with data in 2007 to 2008, showing that Black women here in the city of Chicago were at a 62 greater mortality rate to die from breast cancer. We looked at other cities such as New York City, Philadelphia, and San Francisco that had similar makeups as Chicago and diverse population, and those cities almost had no disparity. So then it began a questioning, and our organization was founded by two epidemiologists, Dr. David Ansel and Dr. Steve Whitman, as to why this problem existed. So we had a community calling where we got individuals in the breast cancer space, oncologists, radiologists, MAM techs, community members, just people invested in this to really have a community conversation as to understand what was going on. So some of the things that were discovered were basically the lack of resources for high mortality rates. So when we look at this map here, you can see in the areas in green, these are predominantly African-American communities that have high mortality rates in breast cancer, meaning that Black women are dying at great rates, compared to where you have approved American college surgeons or cancer programs. And so as you can see, none of those facilities happen to fall within the communities where the high mortality rates are. That led us to several conclusions that basically there was a problem with access to quality actual care and actual quality treatment. So our central hypothesis here at Equal Hope is unequal access to high quality healthcare is a significant driver in the overall health disparities, including breast cancer mortalities in Chicago. So throughout our research, Equal Hope is a model, and we'll talk more about our model a little bit more into the slides, but throughout our research in 2017, we were able to show that our approach was working and that we were able to reduce the disparity rate from 62% to 32%. And Chicago became the #1 city for improving cancer outcomes for women. Now, we do this through our quality consortium, and we have almost all of the facilities here in Chicago participating and donating data to our facilities where we can actually measure these disparities. So throughout Equal Hope's existence, although we started in breast cancer in 2018, we realized that there are more than just breast cancer disparities out there. Although we're really good at pivoting and focusing on one intervention, specifically when we were sending women to get CVEs through the Illinois Breast and Cervical Cancer Program, we saw a vast disparity in cervical cancer as well, as we saw that Hispanic women were being diagnosed more with cervical cancer, and Black women were still dying at the greatest rate from cervical cancer. We actually found this to be jarring and realized that this was an initiative that we also had to focus on. Right before the pandemic, we also expanded our model to include primary care because we realized getting people to preventative cancer screens was amazing. But overall, what about the other comorbidities that individuals experience, such as diabetes and hypertension? And we really wanted to focus and make sure that our clientele was accessing primary care. Because at that time, based on patient data, we discovered that about 85% of our clientele did not have a primary care provider. And so this really speaks to these disparities. As you can see, most of these disparities are basically synonymous to each of these communities. Where the high breast cancer mortality rates are your heart disease mortality rates, as well as COVID and cervical cancer. So throughout our research, we found that a woman living in Washington Park is about 85 times more likely to die from cervical cancer compared to a woman in Hyde Park, although these communities sit right next to each other. This really speaks to our model that resources and income really make a difference here in Chicago. And if you don't have access to those, it can be a life or death situation. So Equal Hope's unique approach is basically one that intersects through out through models. The first is our quality measurement and improvement project, which Sarah will talk about more in the next coming slides. We also have our advocacy and policy model. Anything that Equal Hope does is targeted, but legislation is the really only way to make a systemic change. And it's important that we put policies in place that actually protect low resource or low income communities. And then we have our outreach, education, and patient navigation program. And we do approach all of these things through intersectionality. And we do so because we want to improve people's lives, not only in the spaces that we are, but holistically. So I will pass it on to Sarah.
Thank you, Dr. Thomas. So Equal Care was formerly known as the Quality Consortium, and one area of focus is establishing a collaborative that seeks to improve the quality of breast care at institutions across Chicago and throughout the state of Illinois. So we aim to reduce health disparities and promote health equity for all. And one project that we're currently working on, we receive state funding, and it's to oversee a statewide assessment of mammography quality and capacity in Illinois. So in this project, we're helping facilities determine what benchmarks they are currently meeting and also identify areas of improvement. So in addition to creating these site-specific reports, we're also hosting a series of free education courses for mammography technologists and radiologists so that they could be informed and trained on the most recent advances and quality practices for breast health. And then another goal of this project that we're doing right now is to hopefully reestablish the increased reimbursement rate for mammograms for facilities that participate in this quality improvement project. So all in all, we hope to help assist facilities so that they might be able to help measure their services to find gaps or areas of improvement and to ultimately improve the health and quality of healthcare for women in the state. Next slide, please. So in addition to overseeing a quality improvement project, Equal Care is also interested in researching the drivers of health inequities in Chicago. So there has been a plethora of studies that have been reported large drops in cancer screenings since the beginning of the COVID pandemic, but research has shown that not everyone has been impacted equally. So based on a recent publication that was led by Equal Care, we collected mammography volume data from over 70 Chicago area facilities. And we were able to characterize each of these facilities based on their accreditation status, the volume of mammograms that they perform each year, and also various socioeconomic and socio-demographic factors that are based on their patient mix. We found that the accredited facilities had lower screening volumes in 2020 compared to 2019, but they were actually able to conduct more diagnostic mammograms in the pandemic affected years. But the same was not observed for those facilities that are serving a predominantly disadvantaged population. And all in all, we saw that these highly accredited facilities and high volume facilities basically had the resources to triage their diagnostic patients, whereas the lower resourced facilities, they struggled to keep up with screening and also diagnostic volumes that were observed that they had seen in 2019. So this is why Equal Hope plays a vital and important role in helping to women schedule their appointments and also keep up their appointments. And I'll lastly add that the data that we collected in this project is extremely unique because we have an almost complete screening mammogram data set and therefore might be able to accurately determine screening utilization rates. So this is a current area of research that we're trying to explore to kind of understand where in the city there might be lower rates of mammography utilization and what external factors might be contributing to that. Next slide.
So my name's Donalyn Schaefer, and of course I do outreach for Equal Hope. One of the unique things about Equal Hope is the fact that we are boots to the ground in all of our communities, whether it be South Chicago's, South Shore, Inglewood, Auburn, Gresham. We meet people where they are, and I think that's very important to meet people where they are as far as our education in outreach. And so for our team, we have a team of 6, 4 bilingual, 3 English. And so we are all over the city of Chicago and the suburbs doing outreach and education for not only breast, cervical cancer, and the importance of having a medical home. As Dr. Thomas said, throughout our work over the years, we have found that people need more help than just breast, because it's awesome to have healthy breasts, but if everything else is falling apart, what's the point of having healthy breasts? And so one of the things I'm super excited about Equal Hope is that we have expanded our services to include other morbidities. The other unique thing about Equal Hope, one of the things that I love so much that's so important about our program is our navigation team. Our navigation team takes our clients from point A to point B, to point Z. Once the outreach team bring our clients in-house, our navigators take over. They will help them get their films. They will help them get their appointment schedule. They will remind them of their appointment schedule. They will go with them to their appointment if needed. And I think, just me, but I think that is so important to have someone to hold your hand throughout the whole process, because we know that oftentimes any medical issues that you're facing might be a little bit scary, and to have someone that's by your side, like our navigators, our navigators are, part of our team is bilingual, just like our outreach. The other side of our navigation team is also bilingual, but we also utilize Russia's telehealth, teletalk interpret talk to help other clients that may not speak English or Spanish. And so that's another very unique thing about our Equal Hope program. But again, I am often think that for us as the Equal Hope team, what makes us very unique is the fact that we have our navigation team, and our navigation team is awesome. It's one thing to go out in the community and tell someone that they need to get screened, to tell someone they need to go to the doctor, to educate someone on the importance of all of that. But it's another thing to put that in action, because it would be super different for us if I just went out and told people, you need to do this, you need to do that, and then I walk away with no way for them to do it. But with Equal Hope, just by virtue of the fact that we have our navigation teams, so when I say that you need to do something, I'm going to give you a way to take care of it. I'm not just going to leave you out there saying, well, you figure out how you're going to go to the doctor, but you figure out how you're going to get that screening. At Equal Hope, we make sure that we have an avenue for our people to do that. And I just want to add this real quick, that I do tell my clients outside, the medical home project that we have here at Equal Hope is very important, because 9 times out of 10, we know that if you don't have health insurance, that you will hold on to an ailment, maybe try to self-medicate. Let's just say you have a pain in your back, and you're going to self-medicate, you're going to deal with it till you can't deal with it anymore, and then you end up in the emergency room. And we know you're not shot, stabbed, having a heart attack or a stroke, so you're not going to be seen right away. You're going to sit there for a couple of hours, because pain is what? It's invisible. And so when you finally do see an emergency room doctor, he's not going to get to the root issue of your problem, but he may prescribe you something that you may or may not get addicted to, and then tell you go see your doctor on Monday. But of course, you don't have a doctor. That's why you're in the emergency room. But with our program here at Equal Hope, once we have established you at one of our clinics, at one of our medical home sites, then you have a physician that you can call anytime. My head hurt, doc, I don't know what's going on. I got this pain in my back. And I'll just add this lastly. We know often when you show up in the emergency room with symptoms such as a back pain, sometimes you're going to be in the advanced stages of something. And so with Equal Hope, we want to make sure that we're getting to you before it's too late for you to do anything about it. And so again, we're very happy about our patient navigation program. Thank you, Dr. Thomas.
Thank you. So that you guys are aware, just also speaking of Equal Hope and specifically in our patient navigation and throughout our programs, Equal Hope is the largest multi-institution patient navigation program in the city of Chicago. We consider ourselves agnostic. We are not tied to one facility, which makes us completely different. When you look at other facilities, such as hospital facilities, sure, they have community health workers, they have social workers, they have patient navigators, but their realm stops at a certain point because it's always for the betterment of that facility. Here at Equal Hope, we're never in the business of being for the betterment of one facility, but the betterment of our clients. So we stay with our clients all the way through treatment and beyond, through all their needs. We address social determinants of health, whether it's around housing, around food security, but also their care. So we do work alongside our team to make sure this happens. Equal Hope also is set apart as an organization because we're not an organization that just puts an intervention in place. We use data from our quality consortium, which is called Equal Care, to inform any intervention that we do. Those interventions include any policies that we draft and kind of put in place, and in our outreach as well as our navigation. We can't know where to actually intervene if we don't understand the data, because then we're just kind of flying at the seat of our pants and guessing, which is what you never want to do, because that is what leads to results. And it allows us to be able to evaluate and really see that those results are making a change. So all of the pictures you see here are true patient navigators and clients that have went through our program. As you can see, they become close-knit and family members to our patient navigators. We have nurse navigators, 2 of them. One is embedded in 3 Southside hospitals. We provide resources to those hospitals, specifically low resource hospitals, for her to be able to take those clients and then navigate them throughout treatment and serve as basically an advocate for them. They don't have to go through this alone. They don't have to listen to all the advice or treatment options that are given. They can actually talk about it with someone who has that medical knowledge and help them through that. So as Donalyn was speaking, just so that you guys are aware of how our program pathway works, individuals find us through several different methods. They can be referred to us through our hospital partners, which most hospitals do refer individuals to our program, especially if they are uninsured. Through our outreach team, Donalyn is probably our longest serving community health worker. And our outreach team is out in the community. They're canvassing, they're going places that people usually won't go, like barbershops, beauty salons, laundromats, anywhere you could imagine. They're on the ground doing that boots ground work. We also go to outreach events, we host events, and we get clients signed up that way. We also have word of mouth, which is probably the strongest way that people find us. Someone's sister has went through our program, and it's really special because it's a connection that we're a trusted source for these individuals to seek care. From there, they then complete a patient intake and HIPAA form, which then allows them to enter into our program. Our community health workers do a warm handoff to our patient navigators, who are then a part of the program in helping individuals basically not only assess their social determinants of health, but determining their program needs. Do they need a primary care provider? When was the last time they had a mammogram? When was the last time they had a cervical screening, or just some diagnostic work, which is really important? What makes Equal Hope even more special as we talk about wrapping up all these services is the fact that we're a program that really prides ourselves on having culture. So all of our community health workers and patient navigators are individuals who have either come from the communities that we serve or currently live there. They are linguistically attached to certain clientele, or they're culturally attached to certain clientele, because that does help clients really create a safe space to be in our realm. So just wrapping up, this is the Equal Hope program. We are doing a lot of work, specifically on social media. We have a radio show on WVON that is on every Saturday at 11 a.m., where we host health providers and experts to come on and then have these discussions and these hard discussions around health disparities, and specifically for communities of color. As we know this is a big catch that everyone is kind of involved in throwing their hands in, especially after COVID-19, but Equal Hope has been doing this work for the past 15 years. We pride ourselves on being a model of success and hope to continue to replicate that to fight additional disparities here in Chicago. So thank you all for having us.
Thank you all so much for presenting and for the work that you do. First and foremost, I just want to applaud you because it's so crucial, and especially in these communities, and also timely conversation. I literally just had my very first mammogram, the tender age of 35. My mom is a 2-time survivor, and the first time that mammogram literally saved her life. Like, they caught it at stage 0. And so that early detection is so important, and it's also not accessible to everyone. Or you may not know that, okay, if I have a relative who had breast cancer, I need to get screened earlier than the recommended, I think it's like 40 years old, you know. So that information is so key, is so important. And I love the community aspect of it, because it's not just about, as you said, you know, oh, you need to get your screening then, and you need to do this and blah, 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 but like helping people actually get to that next phase, like that. Those navigators are really are amazing people. I'm curious, what kind of training do they undergo, because it is such a crucial role, and just, yeah, fundamental in getting people from, you know, as Donalyn said, from point A to point Z.
Yeah, that's so important to understand how training is worked. So the way that the training specifically for our patient navigator works is that we use a George Washington model for cancer. And they go through basically a very robust cancer training to really understand, for one, medical knowledge, because the cancer space, it is a lot. As you can imagine, you went through with your mother. My mother is also a 2-time cancer survivor. Even for just a lay person with a bachelor's degree, it's difficult to understand some of that. So imagine being a patient who has all these other life factors going on. You're throwing treatment options at me. I can't hear you because I just was told I was diagnosed with cancer and I have all these other things. So our patient navigators also go through training as far as being empathetic and understanding those things. And that's something that we're taught. We also have an internal in-house training system where you learn our processes and the way that our model works, because we're not a typical model. We're not, like I said, we're not for the betterment of one institution or the other, but the betterment for the person. So it has to be a holistic approach that allows people to treat an individual like a person and diagnose them as a person, so that every treatment is not the same. Everyone who is diagnosed with cancer isn't always A to Z. Sometimes there's these weird 1, 2, 3 little pivots that you don't expect to come up because everyone has their own mode. But that is really what our training model is consisted of.
I think that emotional intelligence you mentioned is so important as well. There's the cultural component, and then there's just the empathy, which I feel like is lacking in our society as a whole, but then especially oftentimes, unfortunately, in our healthcare system where you need it the most. And so can you speak a little bit more about, and anyone feel free to answer this one, with that community outreach? I love the idea, like you said, meeting people at the barbershop, at the nail salon, at these community events. What kind of response have you seen from the community as a result of these initiatives?
I'll let Donalyn speak to that since she's the one doing the boots on the ground work.
Thank you so much. I really appreciate that. So, for the most part, the community is receptive to us. I have to just put a little caveat in there. COVID did change that a little bit, where people don't want you getting too close to them to talk to them or whatever. But I think for the most part, the community is receptive. They're very receptive to the information that we have to offer. Like you said, that issue about getting screened earlier, if you have family history, people, engage in that. I just have to share this with you guys that when I first started doing this work way back in 2008, even I, as a Black woman, did not know that Black women needed to get mammograms, that Black women needed to get screened for breast. That Black women even got breast cancer. For me, it was more or less, oh, that's a white woman's disease. It ain't nothing I got to worry about. But it was my misconception. It was my misinformation. And it wasn't because I'm stupid or anything, like I'm dumb or anything like that. It's just that over the years, I've learned the reason I had that misconception is because nobody ever told me. And everything I've ever seen associated with breast cancer was associated with white women. And so for me to be able to go out and share this information with the community, I think that they've been very receptive to us. Not only that, sometimes I get somebody, can you come to my church? Will you come to my family reunion, share this information with them? Of course I will, because we don't know what we don't know until we know it. Right. And it's not like we're stupid or anything like that. We just don't know. And so for me personally, our mission aligns with my heart. So I'm able to go out and share this information with my sisters, and they share the information with other people that they know. So to answer your question, I can go on and on and on all day because this is my passion. To answer your question, I think that people are receptive, like pretty much everywhere I go. I mean, it's very seldom that I have somebody that's not interested in what I'm talking about. And I have to tell you, ladies, I'll be on the CTA, I'll be on the bus, the L, in the bus stops, on the corners. sometimes I go into restaurants. And so again, it's about just meeting people where they are, because we know that middle-aged women, Black women in particular, have a lot on their plate, and their health is almost always put on the back burner. And it's up to our team here at Equal Hope to bring them to the forefront. Now I kind of have a little bit of a model, like sign up and show up. That's all I need for you to do is just sign up and show up. My navigators, they're going to come in, they're going to take care of everything. You don't have to worry about a thing. Just sign up and show up. But yeah.
Well, it's so important, that aspect we talk about, and there's so much emphasis on self-care, 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 and that's a piece of it. But the larger part is that community care. We need that village, and we've been so like torn apart and just moved about and have lost that piece that, you know, like coming up, our parents, our grandparents' generation, I think we're more in tune with that. And so I see you bringing that back, right? Like going into the churches, going to the restaurants and meeting people, like you said, where they are, and the piece about like, you don't know what you don't know. And if you don't see yourself represented, then you can make the assumption, okay, well, this isn't for me. You know, you said it's very white. Like we think breast cancer awareness month, it's pink and it's white. Okay, like that's what you see. And so that you can be easily make that assumption that, well, I don't have to worry about this, or this doesn't impact me. And that can lead to a lot of these like the mortality rate, as you mentioned. And so I'm curious, like, what does the next iteration of, because like the accountability part, I just want to emphasize is like really, that's where I was going with the village, right? Because I said, like, I have in last week's session with the pregnancy and postpartum care, talked about how my sister like got on me to make my follow-up appointments because I was so focused on the baby. And she's like, girl, you got to take care of you. I will make the appointment. What's your doctor's number, right? Like you need someone to like take the phone from you and do it for you, which like the navigators are doing. And so for the organization as a whole, you've done 15 years so far. What does the next 15 years hold? Like, where are you going next? What's the next initiative? How can people get involved? And then I'll answer. I see there's questions in the Q&A, so I just want to let people know I see you and I'm coming for you next.
That is a good question. Obviously, for the last 15 years, as I said, data drives any intervention that we do. So being that we've been in this space, especially in breast and cervical cancer, we also know that clinical trials are underrepresented for minorities, but yet clinical trial options are constantly offered to us when we are going through treatment. For example, I'll give you, my mother was given the option of a cap that could stop her hair from falling out. And I asked about, well, who was your audience when this was tested? And they didn't have anyone of color who was actually tested on that cap. So I'm like, how do you know her hair will actually not fall out? Because that's right. A different grade of hair, right? What are we talking about? So for Equal Hope, we know specifically in these next coming years that we have a strong drive to intervene in clinical trials and get our community involved. We know the mistrust. I think this whole, celebration of healing really goes back to that. When you look at studies like Tuskegee or some of the things that have happened in the past, it's important for us to understand that in order for us to move forward, specifically in healthcare, we do have to get involved, because all the treatments that they put out will continue to be not for us if we're not a part of those trials, but they will offer it to us, but we're never a part of that trial. So Equal Hope does plan to help a lot of the academic medical institutions with that, as far as being able to provide that education and put more education around clinical trials to sign our community up and making and guaranteeing ensuring better outcomes if they do participate in these clinical trials. So that's one aspect of probably the next 15 years that we will really, really focus on. And it won't be easy, because we know there is decades, thousands of decades of mistrust that has just built up around here that has contributed to this. And so to even do this, I'm supposed to be able to hand you over to this institution. They have this drug, you may get the placebo, you may not, it does not work for us. So we really have to understand what clinical trials are doing and how they help us move forward. So that's one piece. The second is that Equal Hope is very, very moving in the direction of maternal health, specifically in reproductive and sexual justice. As you can imagine, I think traditionally we have never thought of ourselves as a reproductive and sexual health organization, but there were 15 Black women who founded this topic, and she said this organization is one of them. And so we are definitely on board to be a part of it and help where we can. And so we know there are so many amazing organizations and individuals just doing this work. And I know for a fact, because I've sat in a room with them last week for like a whole week, that some of them are doing this work without getting paid. And so we are definitely in the space of not only just advocating for our organization, but those smaller people that are doing this work that is impacting us specifically in that maternal health realm, which is so important. As you guys said, you just had a discussion, and I won't get too much in it, but we definitely are going to put our foot in that ring as well, because our model has worked in the space of cancer. And so we believe that model can do the same in the space of maternal health as well. So those are two avenues that Equal Hope is definitely looking to expand to in the future.
That is music to my ears, because I cannot tell you, and I'm sorry, I didn't even introduce myself to everyone else. Like, the panelists know who I am, but I am a health and wellness reporter for Fortune, and also a freelance writer and author and new mom. And all of this is just like, I can't tell you the number of times I'm working on a study for, or writing about a study rather for work. And I look into the study, the demographic data, and it's like clinical trials. And it's like, so just no Black women, no people of color, none of that. Y'all just, okay, cool. And that's just like applied to everything. And everyone takes it for, like what it says. And it is problematic across the board. And so there needs to be that representation and that care, and the focus on maternal health and reproductive justice. It's all intertwined is how I feel. And it's like, if someone's coming to you for one thing and you're able to help them with the other, then that just makes it even more accessible. And so I'm excited for you to go into this new stage and, help people in all regards and aspects of their lives. And as promised, I want to touch on, because we're getting some questions in the Q&A, and so y'all feel free to put them in there or the chat. This one comes from Mary, who says, "This is amazing to learn about. Thank you for your comprehensive approach to these issues." And has a question, which I hope you'll address, is how is this funded? So not sure who wants to take that, but
probably be me. So that is an amazing question. Obviously, doing this work, as I touched on, there are some people doing this type of work that are literally doing it for free from the goodness of their hearts. So Equal Hope's funding structure is pretty robust. Obviously, we do have a strong grant profile that keeps us afloat, but we also have a lot of corporate and individual donations. As far as when it comes to mammography and the available of offering free services, we are a part of the Illinois Breast and Cervical Cancer Program. We're one of the lead agency, which means that we get funding from the state to basically pass through dollars to providers to provide those screenings to our patients for free at no cost, and we will do the reimbursement. We also do a lot of philanthropy work, as you can imagine, having to scope out new funders and new sources all the time to keep this afloat, as we have other initiatives, such as we provide free transportation to these appointments, and it can be costly, but we are definitely committed to that and looking to diversify our portfolio all the time. So that is basically how our program is made up. And I guess if from a startup position, when we first started, when we had this data and we were having this whole collaborative with all these providers, most of these institutions donated their mammograms. Before we were able to get funding to be able to actually provide reimbursement, they donated to our program. And some of them still do today because they are in it. But obviously COVID-19, hospital lost, everyone is kind of overworked at this point and working with minimal resources the best they can. Some programs have had to pull back. We hope in the future that can continue, but Equal Hope will continue to advocate for additional funding resources through grants and through donations.
Yeah, I remember it was years ago, I was interviewing Christia Donaldson, founder of Thank God It's Natural, and just may she rest in peace. And she had mentioned how the organization partnered with Lyft to provide free rides to appointments for people. And I was just like, yeah, like, yes, more of that, please. Let's use these different resources for good and point, people in the right direction and make it as easy as possible for them, providing rides, providing childcare where available, and everything else to just kind of alleviate that stress. Because so often, as you said before, like, we will put everyone else's needs and concerns ahead of our own. Like, I just had my daughter's 18-month appointment, and meanwhile I have to do a follow-up to the mammogram because let me try this again, dense breast tissue. So there's like that ultrasound part after it that also I didn't know until I had the appointment. But it's like, yeah, I'll get to it. And then, like days turn into weeks, weeks turn into months. And so that accountability, that the support that you all, the holistic like wraparound support you're offering is so amazing, so crucial.
And Christia actually did donate that Lift Partnership to Equal Hope as well. So we did work alongside her. So may she rest in peace. She was an amazing advocate and supporter of Equal Hope.
Yeah, love that. Sandra, actually says, I don't have a question, but I do want to say kudos to Donna Lynn on behalf of Karen Hall from Cancer Support Team. So I want to make sure we got that in there as well. And kudos to the public health nurses at the Department of Public Health. Like, yes, kudos to snaps all around, because y'all are doing all the work and appreciate that. So
I'd like to add just one thing. So, I've been here kind of since the beginning, and we have always focused on breast. And when we rebranded and expanded our services, one of the great things about that is that we have services for everybody in the community now, not just women, not just men. We can assist our entire community, trans, everybody. And so I'm just so excited about that, because what we know is that men don't often go to the doctor, just like women, and they have different reasons for not going.
Yeah.
And so for us to be able to offer this services to the men in our community as well is something that I'm just ecstatic about. Like, I can sign up men for services now, and I'm just going to just add this here. One of the things that I see when I'm working in our community is the number of abandoned homes, the number of abandoned buildings, the number of just unlivable areas. Now, I don't want to use that term unlivable. What I want to say is that when we have families living in homes, families living in communities, we have a healthy community. But when we have abandoned houses all over the place, one of the things I often wonder to myself is, what happened to that family? Did somebody die of breast cancer? Did somebody die of prostate cancer? Is that why this house is empty? Is that why this building is empty? So that to me is like a motivator, because I think Equal Hope could play a big part in getting our communities back healthy. Because you guys, I don't know how many of you go around the city of Chicago. There's a lot of abandoned homes in our community. I was just on the west side at a school not too long ago, and the first 5 houses on this one block were empty. The first 5 houses. And to me, that's just sad. And these are houses that are right across the street from a school. So I digress. I just say all that to say is that I'm just very happy about the expansion of our services here at Equal Hope that would include the entire community and not just women. Because men usually say to me, what you got for me? What you got for me? Like, I don't got none for you, but now I do.
Yay. It's the whole family.
And just speaking to that really speaks about the income and resources. Obviously, we know where there's income, there's going to be resources. So when we look at these communities that are impoverished or uninhabitable, it is because there's a lack of resources. So, and a lot of times there's a intersection there, right? When we talk about intersectionality, it's not just healthcare. There's all these other things that play, being via income, education, community violence that play a part, gentrification, all these things are playing a role. And it's disenfranchising populations who need the resources, but don't have access to them because of that income gap.
Right.
So.
It's all connected.
It's all connected. Absolutely.
We have another question from Mary, who says, it's so important to focus on the data. To that point, is there any current or planned research to better understand the etiologies for increased breast cancer in some of the populations you serve?
I'll let Sarah start. Give her a chance to answer this one.
So, thank you for that question. So I think one, as I mentioned, the data that we collected last year, what makes it so unique is that we were able to collect zip code level data. So as Chicago is blessed with a plethora of different socio-demographic factors that are related to zip codes. So we're able to also start looking at not necessarily breast cancer diagnosis, but just the first starting point of mammography utilization. So that's the first step to even entering into the breast healthcare system.
And so when we're looking at the utilization rates, if you see that a certain zip code has lower rates for the number of women that are eligible to get screening there, we can start to look at, what does their actual environmental context look like? What could be some of the indicators that are affecting that? So in terms of understanding like the structural factors that might be impacting screening utilization, that's one area of research. I know another vision that we've been like in discussions about is kind of creating these breast and cervical cancer registries to kind of identify people who have been diagnosed and maybe doing like a retrospective or like study to kind of understand what factors they may have had in the past and just seeing like what could be associated with their breast cancer diagnosis. But as we know, like Equal Health has been really great at like in the past like decade of like decreasing this breast cancer mortality disparity. But as we know with the pandemic, a lot of these advances may have been reversed. And so we have a lot of work cut out for us. And so, I mean, in a nutshell, that's kind of like where we are, just to try to like create like an equitable quality life for everybody too. So hopefully that answers your question.
Great, thank
Yeah, and
you.
with Sarah's data, I know exactly where I need to go in the city to find my uninsured and unscreened women. So Sarah is just super important when it comes to the evidence base, where I need to be in the community. Sarah's like, they don't got no insurance over here. They haven't been screened over here. So you need to be in zip code 60636 or wherever the zip code is according to her data. And I really appreciate that.
That's that teamwork makes the dream work, right?
Absolutely.
Love that. And if anyone else has any more questions, feel free to drop them into the Q&A. And let's see. Oh, the chat is okay. I see what you're saying now. Sorry, lost my train of thought. Is there anything else that we haven't touched on? And then you said what's coming up for the next 15 years that focus on the clinical trials and the maternal health as well. Actually, I take that back. I do have another question. Where does mental health fit into kind of what you all are doing as well? We're going into Mental Health Awareness Month in May, and I think that is, there is so much, and rightfully, attention on physical health, but the mental aspect of it, because I mean, I know 19-year-old me, when I found out my mom was diagnosed with like immediate, like you think cancer and you think death sentence. And so it can like that mental part of it is important to care for in patients and people as well. So curious as to where that falls into planning as well.
Yeah, L'Oreal, it sounds like you and I live the same life. My mom was diagnosed when I was 18 and I was like, yeah, I'm about to drop out of school and come take care of you. And she was like, no, you're not. You're going to stay in school. Because so I feel like we've lived the same life, but I think that's important just to answer your question as to where does mental health fall, because that is such a big piece here, right? So Equal Hope is not a designated mental health organization, but we do have close ties and partnerships with organizations who do this work. And so in doing so, when I say we do that assessment of social determinants of health, whether it's mental needs or that, we can refer people to the specialists they need. But I think in a sense that when you're building this culture and you're using individuals from the community and you have that workforce reinforcement development within our organization, you're building that on its own. As I said, we have a nurse navigator who is literally helping individuals to care, but they confide in her about everything and just a sounding board. And sometimes it's not even just a therapist, and I'm encouraging people to go get therapists, trust me, therapists and mental health experts, but sometimes it's just a girlfriend circle. And some of these individuals don't have that because they spend all their time working, or I'm a grandmother and I'm taking care of my 6 kids because my kids are wherever in life. And so I don't need my kids to know I have cancer. And they literally just act as a sounding board and release all of that onto our patient navigators who do take it with a grain of salt. And so that mental health is double-sided, because then we as an organization have to do our due diligence to make sure our staff is in a good place to be able to receive all of that, because that's a heavy list of other people's trauma. But I think it's important to have that sisterhood and be able to lift up individuals. And so we are definitely in that space, but we are also assessing if there is further things that they need, such as therapy or, abuse, substance abuse counselors, or whatever it is. We're making sure that we're getting them to those right places, and we're constantly developing those models. I also think right now everyone has pivoted and said, hey, community health workers are the answer, which I absolutely think it's the answer. But I also think that training is along with that.
Yeah.
And so we are working with several collaboratives to understand how we can give our community health workers additional training specifically around mental health and trauma. Because Donalyn is what I call a frontline worker. She's in these communities walking up to people. You never know if it's good or bad day, right? And so she's handling all of that with a grain of salt. So as we send our community health workers out here to do this type of work, it is important that we equip them with the tools to handle and de-escalate any situation that arises in front of them, right? So we are constantly finding new training resources and helping other organizations understanding that we need the finances and pushing legislation to give us more money so that we can continue to educate community health workers so they can do the jobs that most people won't do, because most people won't go into certain communities, but community health workers who have lived in those communities their whole lives will. So that's how we're addressing mental health. Sorry if that was a little bit, but
well, you said the parallel lives, and when I drop out of school, now this is a total aside, but yeah, I was studying abroad. I was in Spain, and my family didn't tell me until I got back for Christmas break. And I was like, why didn't you tell me sooner? Like, this happened months ago. And they're like, because we knew you were going to get on that first plane out, cross the Atlantic and come on back home. And I was like, you're right. But like, that was my choice to make. So yeah.
Same thing. They hit it for me for a few months because they said I'm dramatic, but whatever. So
are you a Scorpio? I can't. We're here. We're here. Love that. Natasha, we have another question in the Q&A. Natasha says, this is such an important discussion. Thank you to Equal Hope for all the intentional work that you're doing in the communities. As I'm listening, I hear the vastness of the work that still needs to be done. Curious to know, how do you, Dr. Thomas, stay hopeful? Good one.
It's a good one. You know, in this space, and specifically as someone at my level, I listen to a lot of people in this space, whether, you know, that are diverse in some of their opinions. I think for me, the reason I stay hopeful is that I believe we can move towards a solution. I do believe that. I'm not anti against anything. I'm not anti against these healthcare solutions or healthcare facilities. I just want us to do better. And doing better doesn't just mean like equipping people with community health workers. It means looking at our organizational models and making sure that they're diverse from the bottom all the way to the top, because you would be surprised. The people that need to be at the table aren't always at the table making these decisions. In these huge hospital academic centers, when they're having these conversations about the disparities and the things they're seeing, besides looking at that bottom dollar, who is having the conversations about disparities? So I'm hopeful that we can continue to advocate and push individuals to get the education and get in these spaces and be a part of the table. I believe organizations and myself, people know I'm always going to advocate was the community at the table. I say it all the time. I'm like, we can all sit here behind our desk and say we're doing this work. I mean, you know, I grew up on the West Side, that's fine, but I'm a little disconnected, and I look at my privilege. And I think as someone who's come from a marginalized community, I'm able to step back as a Black woman and say, I see my privilege in this space. You need to go see A, B, C, D, E and get them at the table and have these conversations, because maybe I'm a little bit disconnected. And I think if everyone did that same thing, we'd be in a much better, further space here. But I think it's about removing ego. And I guess that's what keeps me hopeful, is that if I continue to have these conversations and make sure my voice is heard and make sure that I'm advocating for the people who don't have this type of platform, that we can move these needles and we can combat health disparities, because there's such amazing work. There's great allies. There's great interventions. There's so much money for everyone. I believe it's not a competitive space. I tell people I'm about collaboration. CBOs, I feel like are always put against each other because we have these pot of money that we're always, it doesn't have to be that, because I think philanthropy is moving more towards collaborative, and I see collaborative efforts making a difference. And instead of pitting us against each other, helping philanthropy understand how they also have to diversify and look at the way that they fund nonprofits, because this is important work that everyone is doing. And as I said, it's an intersection, it's intersectionality. It's not just the equal hope problem. Like you said, it's a mental health thing. It's getting the food banks on board. It's getting the housing, part of it. It's getting, incarceration and prisons involved as well, because there's a whole other population that's sometimes left out of this conversation. So I have hope for the future, just because I'm a hopeful person and I'm going to continue to remain. I think we've made a lot of great progress, but we definitely have a long way to go. And COVID-19 did not help that any type of way. It actually set us back a few marks. And so I believe, because people have seen that and the impact that COVID-19 has made, I believe it's making people who have never been a part of these discussions look at this in a different light. Everyone is like, especially, after COVID-19, George Floyd, everything that happened, everyone seemed to turn their attention to disparities, right? And we're like, throw money at nonprofit, throw money. So I tell people, especially corporations, big entities, don't just do this in a moment. This is a lifetime. If you're going to commit to diversity and equity and trying to fight inequities, you have to continue to put your money where your mouth is and make sure that you have the right people at the table and the right people that represent those communities.
And because I love this question so much, I want Sarah and Donalyn to weigh in as well. Like, what is keeping you hopeful? Why do you continue to do this work?
I think for me, I love being able to find ways to answer complex questions. And I'm just hopeful in this space that we're looking past just like individual factors that might be impacting some of these health outcomes and starting to take a step back and looking at the structural factors. And I love the model of Equal Hope and how we partner with like advocacy and legislation to make impactful change on a systemic level. And I've been with the org almost 2 years now, so I'm still like very baby level, but I've seen that take place and saw how like legislation has been impactful in like even just restarting this quality initiative that we're doing right now. And then I love coming into the office and seeing all my coworkers, and I deal with a lot of the numbers, but I get to hear like the story behind all those numbers when they're talking to me about some of their clients and just some of their stories that they're sharing. So I'm just hopeful because of the work and also my colleagues too, because we're all in this together. That collaboration is key.
And how could you not love working with Donalyn? Like, I'm just loving being in this panel. Like, your energy is contagious. I love it. I love it.
She's my desk coworker.
Oh, how
right here.
lovely. That's amazing. I love that.
So for me, it's a little bit different. When I started this work, my degree is in electronics. I used to fix computers, laptops, printers. I used to go to people's homes, small businesses. So for me, it's just a little bit different. I actually got started through a grant that this organization provided my church. And just knowing of the disparities that was happening with Black women, which is what made me very passionate about this. What keeps me hopeful is just seeing the difference that we have made over the years. Like, you can do a lot of work. You can do a lot of work with corporate organizations. You can do a lot of work, but you don't never really see the actual results of what you've done. And so for me to see the work that we've been doing and over the years to see the disparity being addressed and the numbers dropping, that always keeps me hopeful. And to work in the community to get someone their first mammogram, to get someone back on track, they haven't had a mammogram in 5 years, and I'm able to get them to sign up and go and get their mammogram. I don't care if I had the worst week. If I get one person to say, Donalyn, I'm going to get my mammogram, give me that application, that keeps me hopeful every single day. I do have to share that I was a little bit disappointed when I found out that our numbers are kind of creeping up a little bit because of COVID. And so that motivates me to get out here and share even more information about what Equal Hope can do and will do for the community. So I just like helping my sisters out. I just like seeing, one of the things that for me personally, my grandmother died when she was 52 years old. Very, very young. I was 9 or 10 years old at the time, but I saw what that did to my family. With my grandmother dying, my mother being the oldest of 6 children. At 29, she did not want to be the matriarch of our family. She was 29 years old. But because of that, our whole family is splintered. It's kind of like we're not as cohesive as we should be, the uncles, the cousins, the nieces and nephews, everybody, we're not like that. And I do believe, earnestly, I believe in my heart, is because my grandmother wasn't here to make sure that we stayed the family that we should be. And so that's another motivator for me, because I know when you lose the matriarch or patriarch of your family, 9 times out of 10, you're going to have a splinter family, because you don't have the nana or papa to say, you're going to be here Sunday dinner table, Sunday dinner, you know what I'm saying? Your feet under the table. I don't care if you don't like your sister. I don't care if you don't like your cousin. You're going to be here. And that keeps a family together. But when you lose that person, that stronghold in your family, it leads to splinter family, and it leads to what we have in our neighborhoods now: empty houses, empty buildings. Just so again, that's a motivator for me, because I love this organization. The mission is aligned with my heart, And I believe that the work that we do can help us have healthy communities. So that's what keeps me motivated. I can go on and on and on, but I won't.
No, I love it. We need to like equal hope, saving lives, saving families. That's like the new motto, right? There's a whole rebrand right there, right there.
Oh yeah, I like that.
You heard it first
I
from
like
Donna
that.
I
Lynn.
have to get you on the strategic planning team. So we'll come up with these
Yes.
models.
Love it. And we have one more question from Sandra, who asks, does Equal Hope have an advisory board with a patient on it?
We actually do. So Equal Hope has a community health advisory committee where we do encourage clients to be a part of. This is actually probably one of our most comprehensive committees where we get community partners, physicians, patients, and our team on board, because it's about, like I said, having that very much community collaborative type approach. So if anyone is ever interested or wants to give back in that way, we more than so would welcome it. We also have a health ambassadors program. We're in our first cohort where we really aim to help younger populations, specifically in underserved communities, understand the work that we're doing and understand how to be advocates for themselves and even community organizers. Because we understand that, right now in Disparities, we're seeing mobility issues specifically on the West Side and South Side happen at younger ages, which means that, we're not accessing care. And I tell people the story all the time, even when, I went away to school and I was in that like 18 to 20 age, I don't remember seeing a doctor. I don't remember that being like a priority, but it really should be. Like just last month, I figured out what my grandfather died from. Someone finally gave me all the pieces I needed for me to figure it out, but it was always just like, oh, this happened and this happened, but we were never really told what happened. And so I finally put it together, but that's not uncommon. We know that grandma died from having a sugar. What is the sugar? We got to have these conversations and understand what it is, because even those of us that go on to get advanced degrees, I was confused. I was like, wait, what did grandpa die of? He had colorectal cancer. No one, I guess maybe my family didn't understand that, or that was not clearly said to them, but that is what he died of. And so I'm like, this is a problem. And we have to have these conversations. I know Donna Lynn is an advocate and proponent of having these community conversations and understanding our family lineage, because that's really important. So if you're ever interested or you want to get your kids involved, we have several mechanisms and support things that are going on to support that.
Listen, same lives, because I was literally on the phone with my mom. Because yeah, at my big age, at 35, I called my mom to help me fill out the family history form for the mammogram. They do like the whole everything, family history and who died of this and what age and everything like that. And going through it, but it's so important that, and now that I have it, I'm like, okay, I can pass this on to my daughter, and she hopefully won't have to call me, because it'll be right there and written out. But that information is so important to know your family history. What are you at a higher risk for? And it's just the conversation they can be uncomfortable, right? But they are vital to our healthcare. And so it's important that we have them with our family, and that cousin and auntie and everybody else, like pull your information together and let's figure this out. And so
yeah, we have to relinquish those family secrets.
Yes.
I know the African American community, we have a lot of family secrets, a lot of them. And so, especially way back when. And so I share with my community that we need to take those times when family get together for holidays, whatever it is, take this time to go over your family's medical history, pull out that family Bible. Let's talk about the family tree, where everybody came from, what they had. I mean, this is discussion that is needed so we can save lives. So I totally agree with that.
Yep. Just amen. Because the family secrets and everything, finding out, oh, this person is actually that. And it's just like a whole Tyler Perry movie out here, but we need to talk about it. We need to talk about it. It's literally a matter of life or death. And I think the more people realize that, and they'll be more forthcoming with the information. So Mary it's not a question, but just have to say that this has been a great joy to hear all about your awesome work. And I just want to co-sign that as well. So thank you all. Any parting words, anything else you want to leave us with that you want people to walk away from this conversation knowing, or any actions to take? So I schedule your mammogram and any other preventive care that you need. So
I just want to say Equal Hope is available to come out to any event, family reunions, house parties, whatever y'all doing. Equal Hope is available to come out, do education, and get people signed up who don't have health insurance, because we keep that a secret too. As Black women, we want people to know we got it all together. Oh, we got health insurance. We know we don't. And so I would just like to say, invite us out. I'll come out to your house party, to your block club party, to your family reunion, whatever it is, give us a call and we'll show up.
Sarah, do you have any parting words for? No, okay. I think the last thing that I'll just say is we know that there's still so much work to be done, but we all know that we want to make the world better for our generations to come, for the future. I have kids that I want to make it better for. I want them to not have to go through this, because everyone deserves the same livelihood, regardless of skin color, regardless of income, regardless of where you live. We want to save lives. And so if you're committed to doing that, I encourage everyone to, contact Equal Hope. You can reach us via our website. You can call us. You can follow us on social media, even TikTok. We are on there. Find us and you will find Equal Hope doing this work. And we would love to have anyone who wants to volunteer or be a part of our committee or just understand more about our work, reach out. So
A very
thank you
important
guys so
question.
much.
Is Donna Lynn on the TikTok? I want to, because I feel like that's gold right there. Like that's guaranteed to go viral. So we'll have to figure it out.
I'm not on TikTok. I'm actually very shy.
I don't believe that.
You'd be surprised. We're always like, come in this photo. She's like, I don't like taking photos. And so you'd be surprised.
Oh.
She's great in person, but she does get a little camera shy. So no, she's not on the TikTok.
That's fair. That's fair. I'm gonna come out to the Equal Hope house party because I feel like that's a fundraiser that needs to happen and will be a good time.
Yes, no, absolutely.
Ooh, yes, let's do that.
We actually have a community engagement staffer who's a house party artist. So yes.
Love it. Love it. Well, thank you all so much. I'm gonna kick it back over to Jamira and then take it from there.
This has been incredible. Thank you all. L'Oreal, thank you for moderating. And I mean, you all are incredible. I'm in love with your work and really appreciate you all being a part of the celebration of hope. I keep saying that. This is the second time I've said that closing out the webinar. So I think that's going to wind up being the next one. But our celebration of healing. Thank you all so much for what you contribute to that. This has been the Power in the Public Narrative webinar series. And I am Jamira Alexander, the President and Executive Director of Public Narrative. And we look forward to next week's session where we'll hear more about community building through community engaged research. Have a great afternoon.
You too. Thank y'all. Bye.